people prevent, is there a way that a patient can prevent leaks or help prevent leaks?
Yes, leakage is a common complication after surgery, especially the one you cut, bypass or sleeve. The complication, the leak might appear after surgery, especially from 5 to 7 days after surgery are most likely to happen. So how to avoid that? If, as I said before, the diet is an important part of the surgery. That's why we have the patient have liquid diet and fluid diet in order to avoid sudden stretching of the pouch right after the surgery, because most of the resistance of the surgery is from the sutures and staples we use. And even though they are very good, if you have a large swallow or a large amount of food, that might stretch a lot the pouch and that might become a leak. So it's very important for patients to follow the instructions when we said liquid diet, very small sips, and try to avoid to go. It's important, and the patient might help by doing that.
Question, there's people that will say, I'm going to use this surgeon because he's never had a complication. How would you answer that?
I think everybody have complications, especially in the learning curve. It's obviously experience is very important, because the more surgeries you have, the less complication rate you will have, because your learning curve is already fast. But I don't know surgeons that have zero complication rate.
They don't exist. R&Y. Going back to R&Y and failures. We're seeing a lot of people that call in and they have a stoma failure. The stoma has stretched. We're seeing a lot of that. People are calling in and saying, how can that be fixed? Is the band the only fix for that? And how risky is a surgical fix? How far off are we from being able to fix that with an endoscopy, with a procedure via endoscopy?
Endoscopic procedures to help the stomach stretching after gastric bypass they're trying a few, like stomach fix. Another that is working and helps you lose some weight is to inject in some solution, which is sodium morate, to the cardinal points of the stoma that creates a swelling, and that swelling will create scar tissue, and that scar tissue will close the stoma after this injection. You might need 2 or more injections, endoscopic injection of your stoma to create more restriction. But it's kind of common to have pouch enlargement. So some surgeons or endoscopists are using this procedure to try to decrease the weight of patients after weight regain in gastric bypass.
Okay. Should have written that down or something else. Oh, what is the future of bariatric surgery? What are you seeing coming in the next 5 years with bariatric surgery, particularly in light of the transoral surgeries that are coming?
As I said, any new procedure must be analyzed and must be followed by experts, especially in patients that can be followed for longer periods of time. Endoscopic procedures are one of the new things that are coming, but we must be aware of complication. We must be aware of what we are using, because most of the new procedures so far are using prostheses that must be removed within 6 months after the placement. So when we use endoscopic sutures, that might be come off after a few years of the surgery or months of the surgery. So we must have statistics, and we must have patients follow up for 1 or 2 years to know if it's going to work or not before we use it in all the patients, before we say that it's really working or not.
Okay. Gastric balloon, are you using the gastric balloon at all? What do you see with the gastric balloon? I know also she had somebody call in with a 76 BMI. Would that be a person you would use a gastric balloon to reduce the risk before
Yes.
you could do a...
Gastric balloon is a very good tool to reduce weight before bariatric surgery in very obese patients, especially BMIs above 63, 65, because we can use the balloon for 6 months, and at the moment we remove the balloon, you can have the surgery after sometimes from 40 to 100 pounds of weight loss, 6 months weight loss. So we use the balloon to prepare patients to have bariatric surgery. It's the best way to use.
Okay. Can the balloon be used on patients possibly that gastric bypass or sleeve patients that feel that they want to reset their eating habits? Can the
No.
balloon be? No.
No, because the balloon is like a balloon, and we use like from 400 to 700 cc's, and you can blow up everything, the sleeve and everything. So no, it's not possible.
Okay. Going back to the future of bariatric surgery, you have done all the classes in endoscopy. How do you feel that helps you as a bariatric surgeon?
Well, with having all my classes in endoscopy, so recently I became more skilled in endoscopy, so I prepared to do whatever new procedure comes in endoscopy. It's different to do endoscopy and laparoscopy and even open surgery. So we must be trained as surgeons, very good trained in endoscopy before we decide to start doing any endoscopic procedure for patients.
Okay, so do you see that the endoscopic procedures are going to be, I mean, do you see that in the next 5 years?
It will help some patients, but as I said, we must do certain research before we start